The tool that I chose for the screening and assessment video project is the Autism Observation Scale for Infants, also known as the AOSI. I chose this screening because I found it interesting that a tool was created for babies, as oftentimes they are for children over the age of 2. People are not aware that children as young as 6 months can show possible signs of ASD. As a future professional and working with children, I wanted to gain a better understanding of the AOSI so that I can help families get the support their child needs at an early age. While the screening does not provide a diagnosis, and many screenings and assessments will need to follow if signs of ASD are found, it is a great start to getting the child the help they need. The AOSI was designed to identify early signs of ASD in high-risk infants. A high-risk infant is considered those who have an older sibling with ASD. This 18-measure play-based observation screening is designed for children ages 6 to 18 months and takes approximately 20 minutes to administer. This screening is administered by an examiner who has the skills of interacting with infants while also being knowledgeable about the autism spectrum disorder. Along with the examiner, a parent or caregiver should be present during the screening. The screening is conducted at a small table with the parent or caregiver and the examiner across from one another. The infant should be sitting on the parent or caregiver's lap facing the examiner. The parent or caregiver should remain as an observer during the screening, as their only job is to make the infant comfortable. The sessions are often videotaped for the examiner to refer back during scoring, as well as to use the results for future research. In order to detect and monitor possible signs of ASD, the examiner administers 7 semi-structured activities that aim to create an interactive environment as well as elicit particular target behaviors. The target behaviors that the examiner is evaluating have all been selected based on past research that identified the earliest signs of autism. In order to assess the target behaviors, the following toys are used by the examiner: a rattle, a bell, blocks, a book, soft balls, a rubber duck, a plastic stick, and a blanket. The 7 activities conducted by the examiner are based on the following subscales: visual tracking, disengagement of attention, orientation to their name, reciprocal social smiling, differential response to facial emotion, social anticipation, and imitation. Along with those subscales, there are also items that the examiner is observing generally throughout the screening. These include social babbling, eye contact, cuddliness with their caregiver, ability to be soothed, ability to handle transitions, motor control, sensory and motor behavior, and social interest. The task order in which the examiner follows is flexible and often depends on the interest of the infant. If the infant is distracted or inattentive, the trial is repeated. During the screening, there are 2 free play sessions that are designed to create a comfortable environment for the infant and elicit any social babbling. The presence or absence of these behaviors is rated on a scale of 0 to 3. A score of 0 implies that the child is demonstrating normal functioning. As the score gets closer to 3, the child is demonstrating an increasing deviation from the norm. A total score of 9 or greater was considered to be possible indicators of ASD risk. Research has also shown that the AOSI has been a great tool in early identifying autism in patients with tuberous sclerosis complex, also known as TSC. TSC is a genetic disorder with a high prevalence of associated ASD. The AOSI has been used as a measure of ASD-associated behaviors in infants with TSC at 12 months of age. These results have been able to predict a diagnosis of ASD at 24 months with a specificity of 0.89. The AOSI is found to be insensitive to highly verbal children who may be more mildly affected by ASD. Therefore, it is important to use other screenings as well. Oftentimes, the AOSI is retaken at each age marker: 6 months, 12 months, and 18 months. However, if the results do not show signs of possible ASD, and you are still concerned as the child gets older, that there are many other screenings to try. Overall, though, the AOSI is an important tool in helping others solidify early intervention at a young age and should be used as a first step by many parents who are concerned with their baby's development.